Hello dear family of Mount Carmel Dental. Today I want to show you how we do crowns with the aid of artificial intelligence in 2025. Over the past few years we have been acquiring new technologies like CT scans or cone beams to place implants, and last year we started using digital impression scanner. I want to show you the picture of that. Probably some of you have seen it before, but in the office. But in any case, that's the Medit 500, one of the best scanners in the market. And as I said before, we use that to get the impressions now. In the next image, you see me after preparing the crown or the tooth for the crown, taking the impression, the digital impression. In the screen, you see, in this case, is the upper jaw and the lower jaw, and at that point, I'm taking the impression. Now, I'm going to show you what the software can do. Here we have a 3 digital impression of models. We can do it for models, or we can do it for an actual, mouth. Okay, but in this case, we had the models, and we did a scan for the models. The reason for doing that is we're going to replace one crown, an existing crown. What happened over the years, the gum was receding and was showing the margin of the crown. Aesthetically, it wasn't looking good, and besides that, there was an opening or a gap around the crown, leading to bacteria inside the crown. And since there is a crown, there's no way you can see the damage inside the crown to the tooth. So with that, we fabricate a temporary crown ahead of time. So let me show you the temporary crown that we designed with the software. Let me just hide the model so you can see the crown. This is a temporary crown. This is designed with the model. Actually, it mimics the actual tooth or the crown that was in there. And with that design, we have a file, we download a file, and we use one of our 3D printers, and we print the temporary. So when you come for the appointment for the crown, or in this case, when this nice lady came for the crown, to replace the crown, we had the temporary there, ready for her. Now I'm going to show you the artificial intelligence program that is going to help us design Here you can see that after removing the old crown from the tooth, I have cleaned up the tooth, redefined the preparation, and what you see here, this blue line, is the finishing line for the crown. So with the software, I go ahead and then design this line. In the past, we used to send the impression to a lab, and in the lab the technician had to design that. But depending on how good the technician was or the experience, sometimes they did an excellent job, and sometimes a poor one, and which led to redo the crowns, stuff like that. So these days, since we have the tools, we have the software, we have the machines, now I can design the crown because I know where the finishing line is. I did the preparation, so I know where the crown is going to finish, where the crown is going to fit. So I do that step instead to get a better crown, to get a better design, and they just finished the design crown for me. That in the past it took a couple weeks for me to get a crown. These days it's less than a week by doing this using the technology. So once I have the margin design, I tell the software to generate the crown. So basically what's going to happen, the software is going to propose the crown for me. Sometimes it's perfect right on. Most of the times I have to touch it, do a touch up, add some material to some areas, adjust the contact points, or adjust the bite. So usually it takes a few seconds for the program to do that. So in this case, yeah, this is really, so it's working on that, and we'll see what happens. Okay, we can see that the software has finished designing the crown for us. Now what I'm going to do, I'm going to check the contacts and everything, and I noticed that in this area is a little bit thin. So what I'll do, I'm going to add some material to the crown, of course digitally, so it's going to strengthen the crown here. And I just add some material to the crown. Let me just make the brush a little bit bigger. Okay. Okay. Once you know we like the way it looks, now I want to smooth it out. Let me just make this a little bit bigger. Once we like it, then we can save the crown, or save the file actually, so we can send it to the lab. As you see, I add material to the front of the crown. What I'm going to do now, I'm going to check the bite and see how the bite looks like. What I can see is that the crown is not contacting yet. Those color green and blue that you see there, the color green and blue, is where the teeth are contacting. So in those teeth, that's the contact points. Here is contacting too, but as you see, the crown is not contacting. So what I'll do, I'm going to add some to the inside of the crown, the lingual part, so I can get some contact in there. Okay, let me just do that here. I'm adding some contact. Okay, let's see now. We're going to see how it looks. Yeah, this red is a little bit too much, so I'm going to add a little bit to the crown there, but I'll have to take a little bit off too. Okay, it's good there. It's good here too. And now I want to take some material off when I just smooth it out. Okay, just like that. So as you see, the red is going away, and we're getting the green that we want. Okay, very well. So now let's see with the lower model. Okay, now we can see that we're contacting, and let me just smooth it out a little bit more over here. It's a little bit bigger, the brush size, and okay, and that's it. Let me see the contacts now. Let me just see how the crown looks like by itself. Okay, Okay, 103. Okay, very well. It's looking good. And now the design is ready to be downloaded and send it to the lab so they can finish it for us. Okay, basically that's how we do crowns in this 2025. Everything is going AI, so we also got on board. So if you have any questions, please feel free to get in touch with us. Otherwise, thank you for listening to me. God bless you. We'll see you soon. Thank you very much.